Heartbeat Podcast, a podcast about health, politics, and society. Welcome to the third edition of Heartbeat Podcast. As you know, we're a podcast looking at public health, more precisely, population health. And today I'm really glad to be joined in the studio with the UNFPA representative, Miss Dania Gale. Hi.
Hi, I'm excited to be here and happy that we're having this conversation precisely on a day when the United Nations Population Fund is launching our we call it the State of the World Population Report. And it's a report that is published every year.
Yeah, and what can you tell us about World Population Day, particularly in this year of COVID-19?
So the report this year looks specifically, the report this year is titled Against My Will, is define the practices that harm women and girls and undermine equality. And so it gives a number of examples. You will find in the report that it comes up with about 19 specific practices against women and girls that have been almost universally denounced as abuse and violation of human rights. And I think this is so important at a time of COVID, because what COVID has shown us is that these human rights violations and these inequalities has been exacerbated because of COVID. And so it demands on us that every intervention that we put in place, every plan that the government puts in place to address the COVID response should really have an eye for making sure that we leave no one behind.
Exactly. And it's so important, especially now with the news story of the woman who works at Pick n Pay suffering gender-based violence, an attack right under the nose of the security guards. So thank you so much, Ms. Gale. And we will mark this on the 11th of July. So for this episode of Heartbeat, we will actually turn to a lecturer from the Namibia University of Science and Technology, and also to a medical doctor who works on the ground testing for COVID-19. And of course, we'll have our regular segment of people on the streets. So thank you so much, Dania.
Thank you for having me here.
We're back with Heartbeat Podcast. We'll now turn to Word on the Street. Good afternoon, girl. How are you?
I'm good. How are you?
Good. Have you heard of COVID-19?
Yes.
What do you know about COVID-19 and informal settlements?
COVID-19 in our informal settlements, it's kind of not okay because people are crowded and it's not safe because there's no social distancing and people are not practicing the social distancing. It's too overcrowded, I think. And it's not good because if the people are like that crowded in one place, let's take, for instance, a small location whereby people stay in the gambashus next door, it's another one. It's not safe because there's no social distancing.
Yeah. Thank you so much for your contribution. Good evening, gentlemen. You wanted to share something about the state of emergency. We're in a taxi. Can you please go ahead and share?
Yeah, during the lockdown, I'm also there always at Group Mall, just surviving.
Yes.
Now during the lockdown, those guys, state of emergency guys, they come there. We are staying there in the buses. They answer Mabasia.
Who are the state of emergency guys?
Some city police officers responsible for handling or checking after guys that is on the streets and taking them to Commercial Stadium and all those stuff. Now we were staying there, and these guys, they were during the first stage supporting us, helping us out, giving us food. It was fun, but then I don't know what happened. And they just, even the Namibian was there, and they took a photo of our houses and all that stuff, and suddenly they just come remove our houses.
Now what are those houses?
Not like really houses, but it's a structure we built just to be out of the cold. And these guys, they came and just remove everything. Now we are just there on the cold, sleeping outside, but we still really surviving. But other than that, the cold is hitting us. That's why I have to like go somewhere where it's a little bit warm. But we usually mask us and all those stuff, go in raid yards, and we don't always have the money to go and come back and go and come back.
That was Word on the Street, Heartbeat Podcast. Now we will turn to our main interview after this. Welcome back to Heartbeat Podcast. We'll now turn to our main interview with a researcher from the Namibia University of Science and Technology and a doctor working on the ground to test people for COVID-19. I'm joined now with Dr. William Kaimbi, who's a medical doctor at the Robert Mugabe Clinic. He's in charge of case management, and he's also a program health officer at the Ministry of Health and Social Services. Good afternoon, doctor.
Good afternoon. Good afternoon. It's lovely to have me here.
Great. And I'm also joined by Ms. Royal Mabakeng. She is the interim coordinator for the National Alliance of Informal Settlement Upgrading. And she'll tell us more about that. She's currently lecturing in the Department of Land and Property Sciences at the Namibia University of Science and Technology. Good afternoon, Ms. Royal Mabakeng. I want to jump right in. As we know, it is going to be World Population Day on the 11th of July. Can you please tell us about what you do with informal settlements and how that relates to the COVID-19 pandemic?
All right. I'm currently the interim coordinator, as you introduced me, for the National Alliance for Informal Settlement Upgrading. What the Alliance is basically about is a movement that consists of the civil society organizations on land reform, the local authority association, and then also the Ministry of Urban and Rural Development and the university, Nust specifically, around promoting for bottom-up planning, informal settlement upgrading. This is where we are promoting the engagement of local participants in informal settlements as proponents for their own development rather than as beneficiaries.
Right. So they're actually taking an active role rather than being passive.
Yes.
Great.
That's what we want to promote, yes.
And in terms of COVID-19, what do you think should be done?
I think what should be done regarding COVID-19, and this is also not only regarding the informal settlements communities, it's also with regards to the informal traders that we have seen across in the media that they were not really included in some of the discussions surrounding some of the solutions in terms of access to open markets, etc. What I think could happen is that the informal settlement communities should be included in some of the discussions around solutions for COVID-19 prevention. And then in the instance where you have to maybe develop or build, what do you call this, isolation centers,
right,
then you would have people within these communities also participating.
Great. And now to turn to you, Dr. Kaimbi. We spoke about isolation centers just now, and there's also quarantine. Can you please, first of all, describe to us the main difference between isolation and quarantine? Because I think there's a lot of misinformation.
Yes. So, yes, you are right. You are quite right when you say there is some sort of misinformation when it comes to these two terminologies. But briefly, just to give a layman's definition. So when we talk about quarantine facilities, this is where you put people in one sort of facility who may not necessarily be positive or may not necessarily be suspected of the virus. So, and then for those that are being isolated, those are suspected cases. Suspected meaning people that are probably will have the disease or are symptomatic for COVID-19.
Right.
So the main difference is just those that are suspected and those that are not. So quarantine is for those that, for everybody generally, and isolation is for suspected cases. That's the main difference.
Now, in the informal settlements, we know that COVID-19 has begun to spread in our communities, especially in the Irongo region. What are some of the challenges in terms of preventing COVID-19 in informal settlements? And perhaps you can speak about the latency period, meaning if I am in the room with someone who has COVID-19 and let's say we touch common surfaces, does it mean that immediately, if I was infected, within the next minute, I'll start displaying symptoms and I can transmit, or how does it work?
All right. So we know that the natural history of the disease, usually it has an incubation period of around 14 days. So what this means is that from the period that you are infected to the time you show infections, it could take as much as those 2 weeks or more.
Right, we know
so
that. But I'm referring to the period between your time of infection and to the time you can transmit. So we know that you can already start transmitting before you show symptoms, right? But is it immediate?
Yes.
How long does it take?
Yeah. No, right. Usually it can start immediately, meaning as soon as you're infected, right, you can transmit the virus. So what happens is that a lot of the cases, studies have shown that at least 80% of the cases are asymptomatic to start with. So that is the danger of this virus. So many of the people may not even know that they have the virus, or that they may be
there must be a window of time between actually coming into contact with someone who has the disease and me going and infecting someone else. So that window will be particularly important for the health authorities to catch people and contact trace within that window.
Yeah, so but the window, usually WHO states that it's anywhere between 2 days, 2 to 14 days.
Wow.
Right? Yes, in this period, it is transmissible.
So basically, in the informal settlements, so can you speak about some of the challenges? And also you can come in, Ms. Royal, what are some of the challenges of actually tracing someone within 2 days of coming into contact with COVID-19 case or patient?
Okay, we have, as many of us are familiar, I think every Namibian in this country know at least 4 or 5 people that are living in an informal settlement. Maybe just for my testing and also to be sure if the statistic is right, between Dr. William and Pancho, do you know any people in an informal settlement?
I know about 4 to 5 or more.
Dr. William?
I know many. I have family members in informal settlements. I can count more than 10 at least.
Exactly. So 40% of our urban population live in informal settlements. Most of those informal settlements don't have proper roads. They don't have individual water points, nor are there any toilets. So if we have to talk about the transmission of COVID, we know people are going to wait at communal water points to collect water, right? Using one facility, and sometimes these communal water points, as we investigated in a previous case study for Hobabas, is that you would have 3 water points for a community of about over 1,000 households, and with a population of about 4,000. So you see that the transmission would be possible when people have to go to these communal water points. There are also no toilets. So if you have one person in the family possibly infected with the disease, you would have them spending time around a structure that is mostly housing an average of 4 to 5 people. And then these structures are normally, you would have the residential structure, and sometimes they would have
only one room. It's not like a house with several rooms, 4 to 5 people.
Yeah.
Right?
Yes. So it's not a house with several rooms. Sometimes it's subdivided by material, by cloth. So you don't really have, within informal settlements, you don't have this sort of the luxury that most people in the urban setting have if they have to go into isolation, self-isolation, or if they have to go into quarantine, now that we know the difference.
So because
those are some of the challenges.
Ms. Mabakeng, could you please just give us a way forward?
Oh, that's a tough one. Okay, first things first. I think as a country, we should not start thinking about implementing ad hoc solutions. We should try to find a way to implement long-term solutions for the challenges of people in informal settlement.
Great.
The first one is ensuring that we install enough water points in these communities, and then also including the people in some of the solutions, especially around if it's construction of isolation centers or if it's the improvement of the current living structures that they are in. So I think that's one of the most very important points that I could push, could be one of the ways.
With that, I would like to really say thank you to both of you. Thank you, Dr. Kaimbi. Keep up your good work on the ground. And thank you so much, Ms. Mabakeng.
Thank you. Thank you very much for having me.
As you heard, COVID-19 is not just an issue affecting individuals. It affects an entire community, an entire population. Thank you so much for tuning in to Heartbeat, and stay safe, and let's meet again next week. This is Pancho Molongeni signing out.